of vitamin E. Silymarin is an extremely powerful inhibitor of microglial activation, even in low doses, plus all of its benefits for liver metabolism, detoxification. It's a very powerful protectant for the brain, and the thing that really impresses me is how powerfully it suppresses microglial activation. Curcumin and quercetin are both powerful anti-inflammatories. They directly inhibit excitotoxicity. They lower tumor necrosis factor alpha, interleukin-1, interleukin-2. All of these inflammatory cytokines are lowered. Resveratrol is a potent inhibitor of microglial activation and significantly reduces tumor necrosis factor alpha. Ellagic acid, similar effects. Boswellia is a general anti-inflammatory, and magnesium is particularly important because it is an anti-inflammatory, and it is also something that raises cellular glutathione, and it protects against excitotoxicity because remember, it gates the NMDA type receptor. Anyone who has chronic inflammation is magnesium deficient. When your magnesium is low, you become hyperinflamed. That's true of adults, children, anybody. If your magnesium's low, you develop hyperinflammation. Reduce immune overactivity. The silymarin, as we said, is very powerful. Vitamin D3 is very, very potent. It's a neuromodulator, an immune modulator. It plays a major role in brain repair and brain protection. It can directly block excitotoxicity. It is particularly important in autoimmune diseases of the brain. It reduces the damage by autoimmune brain disorders. The omega-3 oils, particularly the DHA, is the most important and the safest. Magnesium, of course. Now the D3, I recommend for most people higher doses. Children can take 2,000 international units easily. There's a new study done in adults that showed those that were taking 2,000 units of vitamin D3, 85% of them were still deficient in their blood levels. So it takes a really high dose to get your blood levels up. And then there's things that directly block excitotoxicity like magnesium, DHA, the tetracycline antibiotics, which you really can't use, but dextromethorphan, the cough suppressant, is a powerful inhibitor of the NMDA receptor, and there's a number of prescription drugs. But the thing you want to know about the glutamate receptors, you don't want to shut them off because that's what's used for building memory. You have to have those to be able to remember and learn. So what you want to do is prevent overactivity, not completely suppress them. And that's why some of the studies in Alzheimer's didn't work, because they just shut them down completely. And that completes our discussion today.
Be glad I brought my neighbor. Thank you so much, really appreciate it. Do you want to take any questions or not? I'll just listen to the thing and let anybody at stage wants a question for 10 minutes.
You can pass around now.
You're dismissed if you want to go on to the break. If anyone has a question, Dr. Blaylock can take a few, and I'll bring the hand mic down and take a few on this side and then a few on this side. Okay, I'll start over here. I saw your hand first. The rest of you are free to go.
I probably need a microphone so I can hear them.
This, yeah, I'll have this one.
Hi, Dr. Blaylock. Whoa, I'm a loud guy.